Hi friends, good morning. I hope you are all doing good. Okay, in this video I'm going to provide you detailed informations about a semaglutide, and this semaglutide was approved by FDA since 2017 December 5, and this is comes under the market two different dosage form. One is injection and another one is tablet. The injection is comes under the name of Ozempic and tablet is Ribelces, and this Ozempic is three different doses: 0.25 milligram, 0.5 milligram and 1 milligram, and recently FDA has approved 2 milligram as well. And Ribelces coming three different doses: 3 milligram, 7 milligram and 14 milligram. So this is a small introduction about this semaglutide. Next one is uses. This mainly used for type 2 diabetes mellitus, not for type 1. This only for adult, not for children. And second one is cardiovascular risk reduction caused by diabetes mellitus. And third one is important one, and this is chronic weight loss management. And one interesting fact is there: this injection is every time out of stock. Let me tell you why this is out of stock in end of the session. Next one is dose. If you are a diabetic patient, you have to start 0.25 milligram. Similarly, you have to check your blood sugar level. As per the sugar level, you have to increase the doses. Injection for weight reduction, you have to begin with 0.25 milligram in addition to 0.5 milligram, furthermore 1 milligram. The units you have to take like 0.25 milligram 10 units, 0.5 milligram 20 units and 1 milligram 40 units. Maximum dose is 2.4 milligram 60 unit. This is maintenance dose. Next one is mechanism of action. How does it work in our body? This semaglutide increase the efficacy of incretin function by activating the GLP-1 receptor, which means glucagon like peptide 1 receptor. As well as this semaglutide help the pancreas to release the right amount of insulin whenever the blood sugar levels are high. And one more mechanism is it suppress the appetite as well as inhibit the glucagon synthesis. Next one is side effect. The patients who are all taking this medication, you should have know about this side effect and contraindications. The common side effect is nausea, vomiting, abdominal pain and diarrhea, constipations. And serious side effect is thyroid C-cell tumor, diabetic retinopathy, acute kidney injury, acute gallbladder disease, hypoglycemia and pancreatitis, which means inflammations of the pancreas. So the patients who are all feeling any of these symptoms, you have to stop to take this medication and consult with your doctors. Next, contraindication. First one is MTC, multiple thyroid carcinoma, which means if you have thyroid problem like hyperthyroid or hypothyroid, you should not take this injection. Next one is MEN2, multiple endocrine neoplasia 2 syndrome, which means inherited disorder that affect our endocrine gland or organ. Third one is hypersensitivity of semaglutide. Next, warning and precautions. If you have any of these disease or disorder, this drug is not suitable for you. Diabetic retinopathy, acute kidney injury, pancreatitis, thyroid issues, acute gallbladder issue and hypoglycemia. So those people should not take these drugs. If you are taking it, make severe the complications. The last one is patient counseling. The first point is this is intramuscular injection, so you can take abdomen, upper arm and thigh. The second point, if a dose is missed, this Ozempic administered as soon as possible within 5 days after a missed dose. If more than 5 days have passed, skip the dose and start the next dose on regular scheduled day. And the third point is, before going to administer this injection, Not only this, any insulin injection, you have to inspect yourself. Any impurities is there or not, or any coloration is there or not. And the fourth point is the crucial and critical point. And this injection you should not share with your family members as well as your friends and colleagues like that. If you are sharing, it may lead to risk of transmissions of blood-borne pathogens, which means perhaps your blood get infected with microorganism. It makes severe complications to you. So do not share this pen with your family members. Even if you are changing the needles, you should not share this pen. Now coming end of these sessions. Before I said how every time this injection has out of stock. Why? Because the most of the people has taking this insulin injection for weight loss. If you are taking up to 12 weeks, approximately 5% of your body weight has reduced. So this is overall about this semaglutide. If I missed any valid point, just put into comment box. Let me inform about that in forthcoming videos. Thank you. Have a nice day. Bye.